Hi class, welcome back. It's Dr. Linder. We're continuing with the introduction to anatomy and physiology, and we're going to start talking about some anatomical terms and anatomical reference terms. You're going to hear things like anterior, posterior, supine, prone, medial, lateral, um, caudal, cephalad, femoral, inguinal, cervical, thorax. It's like important to know what these terms are referring to. So the first thing that's important to understand is this right here that's called anatomical position. Whenever studying anatomy, it's important to say and to understand that everything in terms of its reference points are from this perspective, what's called anatomical position. It's the standard frame of reference. See how she's standing with her feet flat on the floor. She's standing tall and erect, facing forward, and the palms are facing forward, also known as anterior. What we don't see on her, what would be on the back side, is the posterior. So anterior and posterior are opposites. What we see right here is anterior. So this is your anatomical position. So in anatomical position, the hands are at the sides, the palms are facing forward. Now, these two other terms, supine and prone, these two are opposites of one another. They're both lying down, but when you're supine, you're on your spine, which means you're facing up. When you're prone, you're on your bone, meaning your nose, so you're face down. So supine is on your spine, you're lying face up. Prone is on your bone, meaning your nose, you're lying face down. So if you're prone, you're on your bone, you're facing down. If you're lying on your spine, you are supine, you are facing up. And that's the opposite of prone. If you're prone, you're on your bone, you're lying face down, and that's the opposite of supine. If you're standing in this position, that's anatomical position. You're standing upright and your feet are flat on the floor. Okay, those are some basic terms. Now, it's very important to understand these terms as well. So when we hear the word frontal, we're talking about this part of your forehead. It's in the front. So that when we study osteology and bones, and you learn of a bone called the frontal bone, you'll know where it is. When we do muscles, and we do a muscle called the buccinator, you'll have an idea where the buccinator is, because buccal means cheek. When we learn in osteology that we have 7 cervical vertebrae, cervical means neck, and we have C1 to C7. We have 7 cervical vertebrae. When we do osteology and we discover that there's 2 holes in the mandible, and those holes are called mental foramen. Foramen means hole, but mental means chin. Oral means mouth. Otic means ear. Orbit or orbital or ocular refers to the eye. Nasal refers to nose. Cranial is your skull. And your skull has facial bones. When we're talking about the cranium and the facial bones combined, we can say that is cephalic. The armpit is called axillary. So when we learn about the axillary artery, axillary vein, axillary nerve, axillary means armpit. Brachial means arm. So when we do muscles called the brachialis or biceps brachii, or brachii radialis. You know, whenever you see brachium, it's referring to the arm. Antecubital is the front of the elbow. When we talk about the chest, we'll say thoracic or thorax. When we talk about the breast, mammary, like mammary glands. When we talk about the abdomen, it's the abdominal region or the abdominal cavity. And the belly button is the umbilical region. All of these combined, we say they make up the trunk. The trunk. So on McGraw-Hill Connect, it's kind of like a drag and drop. All these terms would be off to the side. You would click them and drag and drop to the appropriate place. So the eye would be orbital, the nose would be nasal, the chin would be mental. This part here where your frontal bone is frontal, the ear is otic, the cheek is buccal. So now we have two things left that I haven't taught you yet, but could we figure it out by process of elimination? We have lateral cervical triangle and anterior cervical triangle. Anterior means front. So, and lateral means to the side. So lateral cervical triangle is lateral and anterior would be here. Triangles are always made and there are borders from different muscles. Okay. All right, let's continue on with some other terms. The forearm is antebrachial. The wrist is called carpals. We've heard of people that have carpal tunnel syndrome. So I have a video on that on my YouTube channel where I discuss it briefly. The palm is called palmar. The fingers are digits or phalanges. But the thumb has a unique name called pollex. Okay, now let's skip down to the foot for a second. Notice the hand had carpals, and there are 8 carpal bones. They're divided into 2 rows. Each row has 4 carpal bones. In the ankle, we have tarsal bones, and we have 7 tarsal bones. So you have carpals at the wrist, but we have tarsals at the ankle. Notice the toes are also called digits or phalanges, just like they were at the hand, digits or phalanges. But notice the thumb was called pollex or pollicus, and the toe is called hallux. So how do we remember that? Well, you drive the car, you steer the wheel with your hand, so car, carpals, and then tarsals, think of the T for tarsals with the foot because of toes. And then pollex, P, goes along with the palm, so the pollex is with the hand, hallux with an H for heel. So the hallux is the great toe, which is with the foot with the heel, so H and H. The foot itself is called the pedal foundation, and some say pedal, right? Because you pedal a bicycle with your foot, but it's pedal. Inguinal is the groin. Pubic, where pubic hair is located, and the pubic bones. And the thigh is called the femoral region. So it's also the longest bone in the body is called the femur. So that's the femoral region. Okay. And notice we are looking at this person from the anterior view, which is the front. When we're looking at him from the back view, that's posterior. So the head is cephalic, the neck is cervical. Remember, we have 7 cervical vertebrae. Back is also known as dorsal, just like the dorsal fin of a fish or a shark, right? That's the dorsal fin. That's the back. The highest point of the shoulder is acromial. That's the highest point. And the back of the elbow that you're leaning on is called the olecranon process or olecranal. That's the back of the elbow. When we look at the lower back, the lower portion is the lumbar, and we have L1 through L5, lumbar vertebrae, L and L, lumbar for lower back. The rump is called the gluteal region. So when we talk about muscles and you learn about the gluteus medius or gluteus maximus or gluteus minimus, the glute muscles are part of the rump. The back of the knee is called popliteal, not to be confused with the front of the knee that's called a patella. Patella is your kneecap. The kneecap is the patella. But the back of the leg, where you don't have bone, it's just all soft, that's the popliteal. The calf is called sural. The heel is called calcaneal. And the bottom of foot is called plantar. The opposite side of the sural in the front is called crural. Crural is like where your tibia bone is. That's in the front. When you get kicked in the shin, that's the crural. But the calf is sural, back here. Okay. So again, like a drag and drop, you'd see the terms are here, and you'd have to go, all right, cervical is the neck, axillary is the armpit, cubital is the elbow, the forearm is antebrachial, crural is the leg in the front, femoral is the thigh, groin is inguinal, arm is brachial. That leaves you with the rounded shoulder, the deltoid muscle over here. Highest point of the shoulder, acromial, armpit, axillary, arm, brachial, cubital fossa right at the elbow, antebrachial, carpal bones, there's 8 of them, and the palm is called palmar. So you just kind of keep doing it over and over, it becomes kind of repetitious. Again, drag and drop to the best of your ability. Inguinal is the groin, the kneecap is patella, coxal is part of the, not coccyx, but it's another name for the pelvic bone. Femoral is your thigh, crural is the leg, tarsal bones, you have 7 of them down near the ankle, and the top of the ankle that you can see is called the dorsum. The bottom of it is called the plantar surface. Okay. Again, kind of drag and drop to the best of your ability. The highest part of the shoulder right here. This is the acromion process. The rounded part of the shoulder is the deltoid. Above the clavicle, the word supra means above. So supraclavicular. And a fossa just means a depression. So supraclavicular fossa. There's your clavicle. This is your trapezius muscle. There's your thyroid cartilage. And there's your SCM, your sternocleidomastoid. Okay, in the center, your sternum. This is your sternum. Sternum has a few different parts to it. Again, there's the word supra, which means above. So right there, that's the suprasternal notch. The top section is called a manubrium. Then there's an angle, which we could all feel on ourselves. It kind of feels like a line, like a ridge that you could palpate. Then this is the body. And at the very end, there's a tip that's shaped like this called the xiphoid process. And you have the nipple. Okay, right down the center is a line called the linea alba. Here's the abdominis muscles, the rectus abdominis. There's your belly button, the umbilicus. Over here is the ribs and rib cartilage. Costal means rib, so that's the costal margin. Over here is the external obliques. This part of the bone is called the anterior superior spine of the ilium. It's part of the iliac crest. And then the linea semilunaris is going this way and this way. So again, lots of big terms, new terms. You're not supposed to have this memorized just yet by any means, but just introducing a lot of new terms. And with A&P, it's a lot of not just new words, but it's a new language also. And you have to be able to break down some of these words. Pectoral major, that's your pec muscle. Umbilicus. Inguinal ligament. Linea alba is the line up the center. Serratus anterior muscle, that's coming along here. External oblique, coming this way. And the linea semilunaris could be this way, could also be this way. Okay, now when we're looking at the body of a whole, you see proximal and distal, proximal and distal. Whenever you're closer to the beginning of a body part, we say it's proximal. And whenever you're moving further away from the limb, further away from the body, we say it's distal. Whether we're talking about the upper extremity or the lower extremity, it's the same concept. When we're closer to the beginning of the body, right here, that's proximal. But when we're moving further away from that point, we're moving distant or distally away. Okay. Medial and lateral, when we're medial, we're closer to the midline of the body. And once we start moving away from midline, we say we're moving lateral. If you're moving from lateral towards midline, we say we're moving medially. The body as a whole, we say superior and inferior, but when we're talking about its parts, proximal and distal. Again, the body as a whole, superior and inferior. When we're talking about the trunk, right, just the center, we can either be moving cranially or caudally. Caudal means to the tail, and cranial is to the head. When you're moving to the front, it's anterior or ventral, and if we're moving to the back, it's posterior or dorsal, just like a dorsal fin. So the back is dorsal, but so is the top of the foot. The top of the foot is also dorsal. The bottom is plantar. Even the back of the hand, that's considered dorsal because it's facing the fin, the dorsal fin. Okay? Good place to take a break. When we come back, we'll talk about the quadrants of the body.